Jessica Radmilovic was a competitive gymnast in high school and had plans of going to college on a pole vaulting scholarship. But at the age of 16, while snowboarding, she took a jump, had a bad landing, and everything changed. She broke her back and is now confined to a wheelchair. But that never dampened her spirit or slowed her down. During her recovery, she found wheelchair basketball, and she was soon recruited to the University of Arizona, where she played for the wheelchair basketball team and went on to play on the USA National Women's Wheelchair Basketball team. She later became a triple gold medalist and holds 2 world records in disabled water skiing. She's currently the recreational therapist in the Spinal Cord Injury, or SCI, Center at the VA in Palo Alto. She provides services to 26 SCI veteran inpatients. She works with the vets to help reintegrate them into the community and daily life after injury. Jessica, I imagine a lot of people, when they hear about your accident, say, "Oh my God, that's my worst nightmare. How awful." How awful was it? Tell me about your accident and your recovery.
So I broke my back snowboarding when I was 16. Took a jump gone bad, fell, and that was that. Didn't really have time. I went to rehab for only about 3.5 weeks. So I was a junior in high school. I was only gone from school for 5 weeks total. So I came home on a Friday and I went right back to school on Monday and didn't really have time to stop and think or, wallow in any sorrows. I just jumped right back into my normal routine, and that was kind of that.
And did it ever come back and just super depress you?
Not really, no, because life just kind of moved forward. And yeah, you have a choice. You can either be happy or sad, and whatever path you take, that's on you. So I chose the happy path.
Wow. And I understand you got some help via your parents during your rehab, who introduced you to something that made a big difference.
Absolutely. So my parents found, right after I got home, they found an article in the newspaper about a local wheelchair basketball program called BORP down in Berkeley. And that very next weekend, sure enough, there I was, swept up by my parents and taken down there and just got involved into adaptive sports right away. And that was just a huge experience for me, kind of with rehab and growth.
And presumably that came from having been an athlete.
Yes.
How much difference did that make?
I think my physical recovery from spinal cord injury was heavily due to the shape that I was in. I was a gymnast, a pole vaulter, a water skier, kind of did a little bit of every track and field, everything. So physically I bounced back really quickly from that.
What about emotionally or mentally? You gave up a lot as an athlete.
No, because I continued to be an athlete. So it was just a different sport, different avenues and different equipment.
Wow, wow. So you also went to a basketball camp, and I understand that was, if not life-changing, huge.
Yeah, so that was actually, I think, my first trip after becoming disabled and using a wheelchair by myself. I was actually going into my freshman year of college, and my mom signed me up for this camp I really didn't want to go to at first in Illinois at the wheelchair basketball program that they have there. But I went, and that was really the first time that I was able to connect with other young people with disabilities, spinal cord, spina bifida, amputations, all that kind of thing. And so I really discovered that community, that I wasn't alone, and I was able to move forward and do all these different things. So I was able to get that kind of peer connection and education from them and their life experiences and be able to grow from that.
So how do you think you changed, well, as a person, but also as a therapist as a result?
As a therapist, I mean, that's huge. My experiences from being disabled and kind of living an active lifestyle through recreation therapy essentially gives me the background to connect with my patients as well, the veterans that I work with. I have that kind of in with them where they can't really say no to me. They can't say, "You don't understand, you don't know what you're talking about," because I do, and they trust me. And so they're able to have real conversations and get really down to the nitty-gritty type of personal things that they might not be able to ask other people.
Yeah, tell me. I was gonna get to that, but let's jump to that right now.
Sure.
Do you think that you really understand things about what they're going through that the able-bodied just don't understand, or not?
Absolutely, absolutely. I have that understanding and appreciation and empathy for what they're going through at that time and what got me out of it and what got me to become who I am now. And they can see that. And so they're able to kind of look at me and trust that aspect of it, and gives them encouragement and kind of motivation to be the best that they can be.
And what form does that take? Is it just kind of subliminal, or is there something very concrete that comes from that?
I think it's just a mutual understanding. You know, it's a small world. The disabled world is a small one. And so when you can connect to another person with a disability, it's just, you have that mutual understanding. Like, you don't even have to talk about it. You just get each other. And it's just there.
So in a way, you just economize and expedite the process, whereas somebody else maybe could still get there, but it would take longer? Or
yeah, I think it's a trust thing as well. People trust my opinion, they trust my advice, they trust what my treatment goals for them are, and they're more willing to kind of buy into that than if maybe I wasn't disabled.
if you'd never had this injury and if you weren't disabled, but we're still doing your same job, how differently do you think you'd be doing it?
Honestly, I don't know if it would be that much different. I think, I don't know, who knows? I might be a really terrible therapist because I don't have the experiences that I do and that understanding and working with people with similar abilities as I have. So I think generally the job would be the same, but I'm just a lot better at it now because of my background.
So tell me exactly, what is your job? What is recreation therapy?
So recreation therapy, probably the best job on the planet. We work along, at least in a rehab setting, clinical settings, we work alongside an interdisciplinary team. So that means we're working with physical therapists, occupational therapists, psychology, the physicians, the whole team gets together because we're working on the same similar goals for that veteran. But the uniqueness about recreation therapy is that we don't just address the physical issues. So I work on spinal cord injury unit. I'm not just looking at the spinal cord injury as that. I'm looking at the person as a whole. So I get to address the social, emotional, physical, cognitive, and spiritual aspects of that person and use recreation activities such as adaptive sports or yoga, creative arts, things like that, to help facilitate growth and change and them meeting their rehab goals in all of those areas. And
is there any other role that does take a comprehensive look, like occupational therapy? Or are there other people doing that big picture thing?
I mean, we all look at the person as a whole, but the difference between recreation therapy, physical therapy, occupational therapy is they have very specific goals that they're working towards, whereas recreation therapy is a little bit more flexible and it's very patient-centered on what exactly their needs and goals are for themselves. And we get to take all that and put them into practical scenarios through adaptive sports and recreation and leisure avenues of their choice and what they're interested in and motivated to do. So we get to really facilitate the change in the real world. So we actually leave the hospital. It's called a community reintegration. We actually leave the hospital and work on the goals that they're working at with physical therapy and occupational therapy and put them into real life scenarios and practical situations that they're going to be doing once they leave. So if there are any issues that come up, we can come back and work on them and triage that in-house.
How new a discipline is this?
So honestly, I don't know when recreation therapy came about, but it is still a relatively new intervention and treatment therapy. So not everybody's aware of it. So we do have to do a lot of education, and you have to get the buy-in from people because it's not seen at the forefront just yet, but it is such a valuable, it's a huge intervention.
Well, I don't know if you get this question, but one obvious question to me seems to be, if it's recreation and it's fun, Why do they need you?
Well, a lot of the time for somebody who is newly injured, especially spinal cord injury, like a very physical, life-changing injury, they just have a lack of awareness. They don't know that all these opportunities are out there. So a lot of what I do is education and exposure and trial and error and getting people involved and giving them local resources in their community that they can access and actually going out there and trying it out. So
now, when you say trying it out, for you, the jump to basketball was from one sport to another. It was a small jump. Do you introduce people to totally different things, like athletes to painting and painters to music or whatever?
Absolutely. There's people who were avid painters before their injury and maybe have lack of use of their hands now. So we get the equipment that they need, whether it's a mouth guard, so they paint by mouth now instead of with their hands. So we can reintroduce them to activities that they formerly participated in, and also new activities, and expose them to things that they might not know existed and have ever tried and might kind of fall in love with something different.
What are the most kind of out there or extreme or unexpected therapies that you've come across that people have adopted?
Oh man, I don't know. We do a lot of adaptive sports. So wheelchair basketball, table tennis, bocce ball. We do a lot of aquatic therapy, actually, because we have a therapy pool at our facility. We're very fortunate to have that. And that one is 150% bought into. People absolutely love that. And
why?
Something that
why in particular?
It's freedom from being in your wheelchair. It's pain reducing. It's physical activity. It's relaxation. And it gets you in a different environment that you might not thought that you could be in after an injury like that.
What are the biggest hurdles? I'm thinking not just physical, but mental.
As far as
the people you work with, that they're going through. What are the hardest things for them?
I think the hardest things for them really is thinking that they can't do anything anymore, that they can't get back to their normal routine, that they can't do these things because they're limited. But that's why rec therapy is so important, because we give them the experiences and the education and resources that they need to inform them that that's not true.
How long does that take for people to come around? It must vary, but...
It varies. One of the challenges with my job is buy-in from the veterans, because, like I said, the rec therapy is kind of a newer program, and they are more focused. I'm here for physical therapy and occupational therapy. I don't need to play, right? But what rec therapy is not is playing.
Okay,
There's
elaborate
so much
on that.
more than that.
Tell me
so,
what
yes,
is it?
we use play as a form of facilitating change and growth and meeting goals. But if you don't understand that and you don't have the buy-in, then they're less willing to participate in rec therapy programs. So what I do is educate, and also make myself, as well as my treatment interventions with other veterans, very visible to those that are giving me pushback. Until then, eventually they're like, oh, hey, what's that hand cycle thing that guy's driving around in? I kind of want to try that. Or, you guys went out to the Monterey Bay Aquarium today? What? Kind of thing. So once you get that buy-in, everything kind of clicks.
How much of that comes from the same experience you had when you went to that camp, which is to say the peer effect?
So peer networking, I think, is one of the most valuable things that we can do, because that's how you learn, that's how you grow, and that's how you can see what other people are doing and then be more willing to try things for yourself.
Tell me about the tell me about the veterans just as a community first. How are they different from the non-veterans? Because you're not a veteran yourself.
I'm not a veteran. The veteran community is very tight-knit. It is very much a brother and sisterhood, that they just have this bond that it's unexplainable, right? They are very much there to serve other people. They always put everybody else first. They put their brothers and sisters first. They put community members first, and they are constantly just serving others, and to a point where they don't serve themselves sometimes. So it's just a really cool thing to kind of see, because like even in the community, if a veteran, two totally strangers, veteran strangers see each other, you know, this guy's wearing a Vietnam hat, they instantly connect and they can talk about everything. And kind of like in the disabled community too, you have that unexplained bond. You don't have to talk about it, you just kind of get each other. You understand each other on a level that other people don't.
Now, I think many people, certainly I, before I talk to you, when I think of disabled vets, I think of combat. What fraction of the people you see are combat injured vets?
Very few, actually. So the unique thing about the VA on our unit, spinal cord injury specifically, is that once you become on a family member, basically, on the spinal cord injury unit, we see you for life. So we see people from brand new injuries, and then every year after that, they come up for a follow-up. An annual evaluation. So you just get a checkup, make sure everything's okay, get them what they need, and then they're out the door. So we get to see them for the rest of their life, and that's really, really awesome. And that's not a program that usually happens in community hospitals and rehabs, right? So we get really close with our veterans, and we get to know them very, very well.
What about those who have been in combat? Is that different?
It just depends, because there's different issues that come up. So PTSD, post-traumatic stress disorder, is a real thing that people struggle with, that veterans struggle with, especially in the community.
And how do you address that through recreation therapy?
There are many ways. We actually have a really good PTSD program over at the Menlo Park campus. So it's an inpatient program that they treat very intensively for that. And they learn a lot of skills through that, coping skills, all of that. So then when we're working with a veteran that has PTSD, and if we're out in the community and an episode happens, we can refer back to those coping skills that they learned in that program and be able to facilitate working through that issue.
And you do see growth?
Absolutely, absolutely.
What is the hardest part for vets in general that might not apply to non-vets? Is there anything that's different?
I don't think the challenges are too much different, although I will say some of our veterans enter the military at a very young age, right out of high school, right? And so it's a very structured environment. They're being told what to do every minute, every second of every day. And so when they discharge from the military and they don't have that structure, and they're just left out on their own, and if they don't have support from family and friends or things like that, then they kind of get lost in the system, the community system as a civilian, where they don't know what to do. And so that's why the VA comes in and has those resources and pulls the veteran in and can plug them into areas that they might need.
So in a sense, you provide that community.
That connection, right? That transition period, right.
What about the ones that are the most challenging? The ones who don't buy in? Is that often?
That's not very often, but the challenge sometimes that I've seen is veterans who are not combat veterans don't think that they can utilize the VA. But the VA is actually there for all veterans who have an honorary discharge from the military, and they can get all their care there.
Wow.
Yeah, so as long as they're using the VA and they know that they can, they're pretty set.
Great resource. So switching from slightly the veteran community and how it's different or the same from non-vets, what about the disabled community? In what ways is working with the disabled different from working with the able-bodied?
I don't know how different it is working with the disabled community or just using different resources and different equipment and different ways to get to places.
Is there a different mindset, do you think, in the minds of people who are disabled, especially if they're permanently disabled? or not?
I think a lot of the mentality and struggles that people with disabilities have isn't actually about them. It's not about their physical disability and how they see themselves or anything like that. It's more about how the community and society views them.
Oh, interesting.
And those are the struggles that people have because they're seen as less than or pitied or unproductive and things, which is entirely not true. Most people with disabilities have careers and are very productive members of society, but they get this stigma around them that from community members that might bring them down a little bit.
And how do you deal with that? That sounds more like the psychotherapist as opposed to the physical therapist role for you.
Right. How do I deal with that? I just move forward by living by example and just educating people that people are people. And it really doesn't matter if you use a wheelchair to get around. I'm still a person just like you, doing the normal things just like you. I'm grocery shopping, I'm driving around, I'm going to school. I have a full-time job. You know, it's not really that big of a deal or big of a difference than being an able-bodied person.
Can you remember any moments where somebody was resistant, let's say, or reluctant, and kind of got it and came around?
That happens a lot, but it does take some time. So like I was mentioning earlier, you get that pushback in the initial rehab from veterans or patients that don't want to participate in the recreation therapy program. But once they do, and if they continue that, they always come back and thank me. Whether it's a year later, 5 years later, they come back, and that's probably one of my favorite parts of my job is because we get to see these veterans progress year by year. I love watching that growth and being part of that. And then also getting that kind of gratification from them saying, if it weren't for you and your rec therapy program, I would not be this person. So that was the most important thing that I did, was participate in rec therapy.
Now, you also handle something big, I gather, the National Wheelchair Games.
Right.
Tell me about that whole event.
Right. So we actually do 2 national events. The National Veterans Wheelchair Games is a week-long adaptive sport competition. And I think there's 19 or 20 different sports that they can choose from.
Wow.
Each athlete can participate in up to 5 of them, compete in 5 of them. And there are about 700 veterans in wheelchairs that are competing at this national event, and it is crazy. We take over the entire city, and everybody has to use a wheelchair to be part of this game. So we have wheelchair basketball, wheelchair table tennis, power chair soccer. We have something called slalom, which is a very intense obstacle course, wheelchair obstacle course. But there's trap shooting and swimming and billiards and kind of a little bit for everybody at all different levels of ability. And so we get to take a group. We usually have about 15 to 20 of our veterans from the spinal cord injury unit go and compete in these games. So,
what is it about that event that seems to be so special and I gather sometimes life-changing? Why?
Well, it's, again, all peer networking, being around veterans who have been to 30 years of these games compared to somebody that's 1 year post-injury and just getting introduced to all these activities and talking to these people and learning about different ways of functioning that they've had, you know, learning just because everybody's different. Things work differently for everybody. So getting exposed to all those different modalities of life can really change somebody's perspective and increase their function or motivate them to do more. And also, sometimes it's the first time a veteran has traveled.
Yeah, tell me about that. Some of the little things that we take for granted.
Yeah, a lot of vets after a spinal cord injury think that traveling's out of the picture. So by us being able to take them to something like the games is a little bit of a safety net for them, and they're more willing to get out and try it. And we're there to educate and walk them through the whole system. So getting on an airplane, what do you pack? How do you navigate an inaccessible hotel room? Because when there's 700 veterans at these games, they don't have 700 ADA accessible rooms, right? So we need to rearrange the bed or take out some equipment or add some things like that. So it's really helps them kind of just learn how to get back into a normal, regular routine.
So in terms of both your injury, but in particular your work, how do you think you see the world differently?
I don't know if I see the world differently per se. I just, I am thankful that I have the experience that I have, so then I can contribute back into the society and be able to kind of motivate people in similar situations right from the get-go, so that they can just go off and running after they leave.
In spite of the hardship and the obvious problems, challenges of being disabled, I get the sense that there are silver linings to what you do.
Absolutely. I mean, I wouldn't be here probably working at the VA with the vets if I didn't have a spinal cord injury. I wouldn't have gone on scholarship to play wheelchair basketball at University of Arizona for my undergraduate degree, which then led me into the recreation therapy profession, getting a master's degree in that, and then turning around and now working at the VA. Also through all the adaptive sports that I participated in, I've been on 2 different national teams. For wheelchair basketball, I played a couple international competitions with them, the women's wheelchair basketball team, and I was on the disabled water ski team for many years, and I actually have 2 world records in 2 different events for that. I've traveled the world. I would just have not had the opportunities that I've had.
Day in and day out, what's the best part
Of?
what you do?
I love every bit of it. There's no dull moment. I love being able to accommodate the specific needs of an individual person based on what they want to do and get out of it. And sometimes it's challenging. I might not know the answer, so I am always learning and I'm always doing new things. And so it's really unique and fun.
What a fabulous example. Congratulations on your award, and thanks so much for coming.
Thank you so much.